Good morning and welcome back. Now, this morning we're talking all things oral health and dental hygiene. This morning, as we have this conversation, I have the privilege of sitting here in studio with the senior dental nurse at the T.R.H.A, Mrs. Jemma
Jemma
Walters.
Walters.
Mrs. Jemma Walters, good morning and
Good
welcome.
morning. Thank
Now,
you.
the T.R.H.A is hosting a dental fair for all of Tobago to be a part of on October the 7th, which is next Monday. Tell us a bit about that.
Okay. Next Monday, it's at the Lowlands Mall. We are going to have our dental health fair. This is an ongoing thing. We had it last year and many years ago, so we look forward to our dental health fair. And this year, we are really focusing on making the children, having the children from the Standard 3 and Form 3 classes involved in the dental treatment. Access to quality dental care is critical, as we know, to the overall health and well-being of individuals. So students from Standard 3, they are preparing for C exam, and those from the Form 3 classes, they are preparing for C-Sec. So usually they are so busy at school, they don't really access the dental care. So we, in the dental department, we are focusing on these children. We want to get them at this age where we can do like fillings, cleaning, extraction where necessary, prophylaxis, and we are really targeting this group because we know they are at an impressionable age where, they have the mixed dentition, the Standard 3, they have the mixed dentition. So we want to make them aware of how to take care of their teeth. And that is what it is about. The dental fair basically is about. But this is the opening day. On the 7th is the opening day, just to introduce what we are going to do. It's an ongoing program, so it's just going to introduce what we are going to do. We are going to have the CEO present, the general primary care manager, the primary care manager, and other people involved in the dental health opening on Monday the 7th at the Lowlands Mall.
All right, excellent. And tell us some of the other activities that will be included under this whole dental campaign.
On that day, we are going to have, like from primary care, we're going to have nutrition with us. They are going to basically, they are going to do like the body mass index with individuals who come along. They are going to do cholesterol testing and so on. They are going to do counseling. Basically, we have the nurses who are going to be there. They're going to do blood pressure. They are going to do diabetes testing and all those kind of things. So we want people to come along. We are there to give oral health information, help the people be aware of their dental hygiene and how to take care of their teeth. So it's like going to start from 9 o'clock, way up to 2. So we are inviting people to come along and be educated as to what dental is going to be doing for the next year. It's an ongoing program.
All right, excellent. And tell persons on a regular, how can they get a dental checkup from the T.R.H.A?
It's like the children. We do up by appointments, all right? But if you have like an emergency, you come in and we do the examination and we treat as we see possible. The other, like adults, they can come in and have examination done too. But we have special days for the adults, which is on a Tuesday in Scarborough, Roxborough, Friday at Moriah and Canaan Health Center. So they can visit these areas to have examination and, counseling as to what is going on in their mouth.
All right, so give us the dates again one more time.
All right, on Tuesdays, we have Roxborough and Scarborough. Fridays, Moriah and Canaan Health Center. They can go there and access treatment or counseling or examination, whatever. They could question them on what they want.
Right. And when it comes to oral health, we know that oral health is a bit expensive. That's why most persons, when they get insurance, it's an additional coverage when you have to
Yes.
get coverage for dental. But to even avoid having to pay so much for dental, it's important to be able to maintain,
Your oral health.
optimal oral health.
That's
And
right.
so, tell us some ways that persons can do
Okay.
that.
To maintain, even though you do the maintenance, you still have to visit the dentist to get your regular checkup. So you have to brush your teeth. You have to do the flossing. You could use mouthwash if you wish, and fluoride toothpaste. We recommend fluoride toothpaste because it strengthens the teeth and helps to prevent cavities. Now you are supposed to brush your teeth at least twice a day. Flossing can be done like once per day, or even self you have usually some people when they eat, you have things stick up in between the teeth in the proximal areas. They could use dental floss, but you can do it every night before brushing. You floss your teeth. Your teeth, they are very important. Many people, they take care of their eyes, they take care of their feet if they lose a foot or lose some organ, but they forget the teeth in their mouth. And when you don't take care of your teeth, you have plaque building up in the mouth. Plaque is a sticky, colorless fluid. It adheres to the teeth within seconds. If you don't remove that together with the food stuff that you left inside, it would form this acid and it starts attacking the teeth. And now that is how you start getting rotten teeth. Now, if you remove the food, then the plaque wouldn't have anything to work with to form this acid to cause the rotten teeth. So I advise people, take care of your teeth. And the thing is with the plaque, it causes many internal organs disease. It could cause spontaneous abortion. People don't know that. It can cause heart disease, stroke, and all that plaque in the mouth. So you have to get rid of the plaque from inside of the mouth.
All right.
Visit
And
your
what about
dentist. Visit your dentist twice a year.
right?
That dentist would detect whether you have cavities or if you are really taking care of your teeth and give you a good polishing.
All right,
Right.
excellent. And when it comes to parents and encouraging their children to, maintain good oral health, what do you advise to have
Well,
that regimen going?
all right.
You have a lot of little children who don't like to brush their teeth.
We know that. A lot of them, they don't like to brush their teeth, but I tell the parents, or we tell the parents, make sure and brush. It's better you fight them and brush the teeth at home before you bring them to the health center with a toothache where we have to give the injection to take it out. So we try and advise them, give them the proper food or to eat vitamins and a lot of vitamin C. Vitamin C helps to clean the teeth, so you give them lots of vitamin C. Watch the food they eat, the intake of their snacks. Watch the sugary snack. It is said sugar is the main cause of cavities. So watch the sugary snacks they are eating. Brush especially at night. That night brushing is very important. So that is what some of the information we give the parents. And try and visit your dentist or dental nurse at least twice a year.
Excellent, excellent. And so, going back to this fair is happening on October the 7th, which is Monday from, is it 9 a.m.
o'clock.
to
Yeah.
2 p.m. So persons are asked to pass through the Gulf City
Right.
Mall in Lowlands just to participate, just to get some information. Would they be able to set up appointments if necessary?
Not there, really. We could give them the address of the different location they can seek help, get the appointment, because we wouldn't be walking with the appointment books. But if you have an emergency, we would be able to direct you to which, according to where you live, which area you can go and access the treatment. Added to that, on Monday, we have some interesting people coming. They are going to join us. This is what we call the Dental Nurses Association. They are going to join us on the opening day. They are coming from all over. So it's going to be an exciting event on Monday the 7th.
All right. And so on those days that you mentioned, Tuesday and Friday, can persons do walk-ins for dental, or they have to have an appointment?
Walk-ins if you are in pain. We
Okay.
don't turn away anybody who is in pain. But
Right.
we prefer you to make an appointment because we have scheduled patients. And then there's a certain amount of patients you can see on that day because the instruments, they have to be sterilized and all that. So we ask you to make the appointment. But if you are in pain, we
Right.
don't turn you away.
All right. And touching a bit on the senior citizens and persons who are taking care of senior citizens, what do you advise with them when it comes to taking care of their oral health and maintaining healthy dental health, as well as being able to manage and clean the dentures and
They
stuff like that?
still have to do the cleaning because you have dentures where plaque build up and they have calculus on dentures. So the caregiver, they have to make sure and clean the dentures, clean the tongue, the gums of those senior citizens, because plaque still forms in the mouth, on the gums, on the tongue. So they have to make sure and clean and brush the denture. Brush the dentures. That's it.
Yeah, you have caretakers, they will bathe the patients and all of that, but you know,
They forget the mouth.
they forget that, you know, that oral health care
Yeah,
is
it's
such
very important, very important. And see, you don't want them to have like bad breath or anything like halitosis or something like that. So they have to make sure and clean the tongue especially because they are eating, and brush the dentures.
excellent.
Yeah.
So we want to thank you so much to you and to, you know, your organization, the T.R.H.A, and all that you guys have been doing to educate the public on oral and dental health care. Thank you so much, Mrs. Walters, and we hope that you have a successful fair and a successful dental awareness campaign. So we want to thank you so much. We're going to take a quick break right here, guys, and we're going to be back
for having me today.
right after this. See you soon. Bye-bye.
It's a brand new morning, rise up to a brand new dawn.